Hello, lovely people. Welcome to my health and lifestyle series. If you're new here, I want you to know that my channel focuses on education, and with that, I come up with scholarship opportunities on a weekly basis, as well as free courses or courses that you can do to upskill or upgrade yourself. I also come up with lifestyle videos and videos on health. If this sounds like something you're interested in, please hit the subscription button and the notification bell so you'll be the first to be notified when I release videos. In this video, we'll be looking at common symptoms of prostate cancer, and I'm coming Just before we proceed, let's find out what the prostate gland is. It's a small gland found only in men, and it surrounds the tube that carries urine out of the body. It usually produces a thick white fluid that gets mixed up with sperm to create semen. It's about the size and shape of a walnut, but it tends to get bigger as men get older. It can sometimes become swollen or enlarged by conditions such as normal prostate enlargement with age, prostatitis, which is inflammation of the prostate, and prostate cancer. We're discussing prostate cancer today because, according to the World Health Organization, cancer accounts for over 10 million deaths a year. And particularly for prostate cancer, it causes about 1.4 million deaths per year in men. We'll start off by looking at risk factors. So, what is a risk factor? A risk factor is anything that increases a person's chances of getting a disease or a condition. One of the common risk factors of prostate cancer is increasing age. So, prostate cancer tends to be common among elderly men. Additionally, according to research, African Caribbean men have a higher risk of getting prostate cancer than men who are not. Additionally, having someone in a family with prostate cancer or who has had prostate cancer in the past or died of it puts a man at increased risk of having prostate cancer. It doesn't necessarily mean that all men in the family will have prostate cancer, but it means that they should be on the lookout for the symptoms we are going to discuss and seek medical attention appropriately. Obesity or eating a high fat diet has also been linked to increased risk of prostate cancer. First and foremost, persistent unexplained backache is a symptom of prostate cancer. This results from spread of the cancer to the backbone or the spine. So if there's any elderly man you know who has had unexplained backache, it's important for him to see his doctor immediately for further assessment. Next on the list is unexplained tiredness or lethargy. This symptom is quite non-specific because it also applies to other cancers as well. So if there's a man who has unexplained tiredness and some of the other symptoms we're going to look at, it's important to seek urgent medical attention. Third on the list is poor stream of urine. This is when the flow of urine is weaker than usual, causing it to take men longer to pass urine. This is a symptom of prostatic disease generally. So some men may have this symptom and it's just because their prostate gland is bigger than usual, which is common for men who are elderly. However, when they have such symptoms, it's important for them to see a doctor to make sure that it is not cancerous. Number four on the list is frequent urination. So, if an elderly man passes urine more frequently than normal and has some of the other symptoms that we've talked about or that we're going to talk about, it's very important for the person to be assessed for prostate cancer. It's important to also note that frequent urination could also be a sign of infection or inflammation of the prostate gland itself. Unexplained weight loss or anorexia is number five on the list. So, if an elderly man has weight loss which cannot be explained or just has a very low appetite despite all the necessary measures that have been put in, it's important for the person to be assessed for prostate cancer. Number six, so for some men, they realize that they have to quickly run to the toilet as soon as there's the air to urinate. Otherwise, they experience so much discomfort, and this is called urgency. The seventh symptom is dribbling. This is when a bit more urine trickles out and stains the underpants as soon as a man finishes using the toilet. If this is a symptom anyone you know is experiencing, the person needs to see a doctor immediately. The seventh symptom is dribbling. This is when a bit more urine trickles out and stains the underpants. Number eight, hesitancy. So this is when a man has to wait at the toilet for a while before the urine starts to flow. Sometimes it takes seconds, sometimes it takes minutes. It can take a very long time before the urine actually starts to flow. And this is a red flag. This is a symptom for which the man needs to see a doctor immediately. Number eight, hesitancy. So this is when a man has to wait at the toilet for a while. Blood in urine. Number nine. This symptom is not normal at all. So as soon as a man finds blood in his urine, it's very important to get checked and screened for cancer. This symptom doesn't only apply to prostate cancer. It also applies when a man has infections or any form of cancer within the urinary tracts, that's the bladder or the kidneys or the ureters. Number 10 on the list is erectile dysfunction. Erectile dysfunction, also known as ED, can come about as a result of many other causes, but it's important for men with ED, even at an elderly age, to see their doctor to be assessed to ensure that it's not due to something sinister like prostate cancer. When a man sees a doctor with such symptoms, the doctor is likely to take a history. By that, the doctor will question the man regarding the symptoms, how long it's been going on for. We'll also like to rule out other things like infections or other possible causes of the symptoms. We'll likely ask about the person's background and family history and so on. And the doctor will likely examine the patient. So there's this examination, which is an intimate examination called the digital rectal examination. And this will involve insertion of a finger through the back passage to examine the prostate gland for features of cancer. Thank you so much for watching to the end. I hope you found this useful. Please drop in your comments in the comment area below. Note that I'll be coming up with other videos also applying to women, applying to children, applying to everyone so we can all stay healthy and look out for each other. See you in my next video.